Hello, mortals. I am Dr. Sombrio, and today we're venturing into the darkest territories of medical science to explore the 5 most agonizing ways a human being can die, according to medical professionals who have witnessed these horrors firsthand. What you're about to discover isn't just about death. It's about prolonged suffering that pushes a human body and mind beyond the limits of endurance. These aren't quick endings, but extended biological tortures that can last days, weeks, or even months. Prepare yourself for a journey through medical hell, where death becomes a mercy that arrives far too late. The accounts you're about to hear come directly from doctors, nurses, and medical researchers who have documented the most excruciating ways human life can end. Warning: what follows is not for the faint of heart. These are real medical conditions that cause unimaginable suffering. But understanding them reveals something profound about human resilience and the boundaries of biological endurance. Let's begin with number 5, Untreated Rabies, a death so horrifying that it has inspired centuries of folklore about demonic possession and supernatural curses. Rabies has a mortality rate of nearly 100% once symptoms appear, but it's not the certainty of death that makes it so terrifying. It's the journey to get there. The virus literally hijacks the nervous system, causing a slow descent into madness that can last weeks. The disease begins innocently enough, with flu-like symptoms that can appear anywhere from weeks to months after infection. But then the virus reaches the brain, and the real nightmare begins. Patients develop hydrophobia, a terror of water so intense that even the sight of liquid causes violent spasms and panic attacks. They become unable to swallow their own saliva, leading to excessive drooling and the characteristic foaming at the mouth. But the psychological torture is even worse. The virus causes severe hallucinations, paranoia, and episodes of extreme aggression alternating with periods of complete lucidity. Patients are fully aware that they're losing their minds, but are powerless to stop it. Dr. Sarah Chun, who treated a rabies patient in rural Thailand, described the experience. The patient would have moments of complete clarity where he'd beg us to end his suffering, followed by violent episodes where he'd try to bite anyone who came near. The fear in his eyes during the lucid moments was unlike anything I've ever seen. As the disease progresses, patients experience painful muscle spasms throughout their body. The throat muscles contract so violently that patients can't breathe properly, leading to a slow suffocation punctuated by moments of gasping terror. The final stages involve paralysis, coma, and eventually respiratory failure. But the cruelest aspect is that consciousness often remains intact until the very end. Patients can hear and understand everything happening around them while being trapped in a body that no longer obeys their commands. Number 4 brings us to Necrotizing Fasciitis, commonly known as flesh-eating disease, a condition where bacteria literally consume human tissue while the victim is still alive and conscious. This isn't just an infection. It's a biological feeding frenzy where bacteria multiply so rapidly that they outpace the body's ability to fight back. The mortality rate can reach 30 to 40% even with aggressive treatment, but survivors often lose limbs or massive amounts of tissue. The disease typically begins with a minor injury, sometimes so small that patients don't even remember happening. A tiny cut, a scratch, even a bruise can provide the entry point for bacteria like Streptococcus pyogenes to invade the deep tissue layers. Within hours, the infection spreads along the facial planes, the thin layers of tissue that separate muscle groups. The bacteria release toxins that literally dissolve human flesh, creating a pathway for the infection to spread throughout the body. The pain is described as excruciating and disproportionate to what appears to be happening on the surface. Patients often report feeling like their flesh is being burned from the inside out. The skin becomes swollen red and extremely tender to touch. Dr. Michael Torres, an emergency physician who has treated dozens of necrotizing fasciitis cases, explains, the patients describe a pain that's beyond anything they've ever experienced. Many say it feels like acid is being poured under their skin. And the worst part is watching their disbelief as we explain that we need to remove large portions of their body to save their life. As the disease progresses, the skin begins to change color, first red, then purple, then black as the tissue dies. Bully or large fluid-filled blisters appear on the skin surface. When these rupture, they reveal the necrotic tissue underneath, which has the consistency and smell of rotting meat. The treatment involves emergency surgery to remove all dead and infected tissue, a process called debridement. But because the infection spread so rapidly, surgeons often must remove far more tissue than initially appears affected. Arms, legs, and sometimes entire sections of the torso must be amputated to prevent the infection from reaching vital organs. Patients remain conscious during much of this process, watching helplessly as their body is literally carved away piece by piece. Many describe feeling like they're being eaten alive, which is medically accurate. They are. Number 3 takes us into the realm of autoimmune horror, Stevens-Johnson syndrome, and its more severe form, toxic epidermal necrolysis, 10. This condition turns a body's own immune system into a weapon that attacks the skin and mucous membranes. 10 has a mortality rate of 30 to 50%. But death is just the endpoint of prolonged torture with the body's largest organ. The skin literally detaches and sloughs off while the patient remains conscious. The condition is typically triggered by medications, with common drugs like antibiotics, anticonvulsants, or even over-the-counter pain relievers potentially causing this catastrophic reaction. What makes it particularly terrifying is that anyone can develop it from medications they've taken safely before. The disease begins with what appears to be a minor skin rash, often accompanied by flu-like symptoms. But within 24-48 hours, the condition rapidly progresses to something that resembles severe burns covering the entire body. The skin begins to separate from the underlying tissue in large sheets. The epidermis, the outer layer of skin, literally peels away, leaving raw, bleeding flesh exposed. This affects not just external skin, but also the mucous membranes of the mouth, throat, eyes, and genitals. Dr. Amanda Rodriguez, a burn specialist who treats 10 patients, describes a horror. Imagine having third-degree burns over 90% of your body, but instead of fire, it's your own immune system causing the damage. The patients are in constant agony. Every movement, every breath, every heartbeat causes excruciating pain. Patients lose the ability to regulate body temperature, leading to dangerous fluctuations between hypothermia and hyperthermia. They're unable to retain fluids, leading to severe dehydration and electrolyte imbalances that can cause heart rhythm abnormalities. The eyes are particularly affected, with the corneas becoming severely inflamed and potentially leading to permanent blindness. The mouth and throat become so ulcerated that patients can't eat, drink, or sometimes even swallow their own saliva. What makes this condition especially cruel is that patients remain fully conscious and aware throughout the process. They can feel every square inch of their skin burning and peeling away. Many describe it as feeling like they're being slowly cooked alive from the inside out. Treatment involves intensive care with aggressive wound management, but the process is agonizing. Dead skin must be regularly debrided, and exposed flesh must be constantly monitored for secondary infections. Patients often require sedation not just for comfort, but because the pain is so severe it can cause cardiac arrest. Number 2 brings us one of the most feared diagnoses in oncology, bone cancer with widespread metastases. This represents a level of pain that pushes the human nervous system beyond its design limits. Bone cancer, particularly osteosarcoma or metastatic cancer that spreads the bones, creates what medical professionals call breakthrough pain, agony so severe that it breaks through even the highest doses of opioid painkillers. The bones contain some of the most sensitive nerve fibers in the human body. When cancer invades bone tissue, it doesn't just destroy the structural integrity. It creates a constant state of nerve stimulation that the brain interprets as unbearable pain. Dr. James Patterson, a palliative care specialist with 20 years of experience, explains, "Bone cancer pain is unlike anything else I've encountered in medicine. I've had patients describe it as feeling like their bones are being crushed in a vice while simultaneously being burned with acid. Even with maximum morphine doses, many patients still experience excruciating pain. The cancer cells release substances that literally dissolve bone tissue, creating pathological fractures, breaks that occur with minimal trauma because the bone structure has been compromised. Patients can break ribs simply from coughing or fracture their spine from changing position in bed. Each fracture brings a new wave of agony that can last for hours or days. Patients describe feeling like their skeleton is crumbling from the inside out. Movement becomes impossible without excruciating pain, Yet staying still is equally agonizing because the pressure on affected bones never relents. As the cancer spreads to multiple bones throughout the body, patients experience what's called total body pain syndrome. Every position becomes unbearable. Lying down causes pressure pain, sitting creates compression pain, and any movement triggers sharp, stabbing sensations. The psychological torment matches the physical agony. Patients become trapped in bodies that cause constant suffering, unable to find even moments of relief. Many describe feeling like prisoners in their own skeleton, desperate for an escape that only death can provide. Sleep becomes impossible, not just because of pain, but because of the constant fear of movement causing new fractures. Patients often develop severe anxiety and depression, not from the prospect of death, but from the certainty of continued suffering. Finally, we reach number 1. Locked-in syndrome with full consciousness, a condition that represents the ultimate medical nightmare, where the mind remains completely intact while trapped in a body that has become a living prison. This isn't technically a way of dying, but rather a way of living that's worse than death, a conscious existence in a completely paralyzed body where the only functioning system is a mind that remains cruelly aware of its imprisonment. Locked-in syndrome typically results from damage to the brainstem, often from stroke, trauma, or diseases like ALS in its final stages. The pathways that control voluntary muscle movement are severed, but the areas responsible for consciousness and sensation remain intact. Patients can see, hear, think, and feel everything happening to them, but they cannot move, speak, or even blink in most cases. They become witnesses to their own biological imprisonment, fully aware but unable to communicate their awareness to the outside world. Dr. Lisa Chun, a neurologist who has worked with locked-in patients, describes a horror. Imagine being buried alive, but instead of dirt, you're buried inside your own body. You can hear your family crying, thinking you're in a coma, but you can't tell them you're fully conscious and listening to every word. The psychological torture is unimaginable. Patients must endure every medical procedure, every conversation about their condition, every decision about their care, while being unable to participate or consent. They become unwilling eavesdroppers to their own medical discussions, including conversations about ending life support. Some patients develop a limited ability to communicate through eye movements or blinking, but this can take months or years to establish. Until then, they exist in complete isolation, their minds fully active but unable to reach out to the world. The physical suffering is equally severe. Because they cannot move, patients develop pressure sores, muscle atrophy, and joint contractures. They experience pain from these conditions, but cannot communicate their discomfort or request relief. Breathing often becomes difficult, requiring mechanical ventilation. Patients must endure the uncomfortable sensation of having their breathing controlled by a machine while being unable to adjust their position or clear their throat. Perhaps most cruelly, patients retain their emotional responses. They can feel frustration, fear, sadness, and desperation, but they cannot express these emotions. They may want to cry but cannot produce tears, want to scream but cannot make sound, want to escape but cannot move. The condition can persist for years or even decades. Some patients have reported later that they spent months or years planning their own suicide, only to realize they were completely unable to carry out any action whatsoever. These 5 medical nightmares represent the absolute extremes of human suffering, conditions that push consciousness beyond the boundaries of what we thought possible to endure. They remind us that there are fates worse than death, and that our biological existence, while remarkable, can become a source of unimaginable torment. What makes these conditions particularly horrifying is that they strip away everything we consider essential to human dignity, the ability to communicate, to move, to escape pain, or even to die on our own terms. Medical professionals who treat these conditions often struggle with their own psychological well-being. They're forced to witness suffering that challenges their fundamental beliefs about healing and helping others. Many report that these cases have changed their perspectives on life, death, and the meaning of mercy. The cruel irony is that modern medicine, in its efforts to preserve life, sometimes prolongs these forms of suffering. We've become so skilled at keeping the human body alive that we've created new categories of torment that our ancestors never had to endure. But perhaps there's a lesson in understanding these extreme forms of suffering. They teach us to appreciate the simple miracle of painless existence, the gift of movement, the blessing of clear communication, and the precious nature of comfortable sleep. They also highlight the critical importance of advanced directives and honest conversations about end-of-life care. Knowing about these conditions can help us make informed decisions about our own medical care before we're unable to advocate for ourselves. Remember, mortals, every day you wake up without pain, every moment you can move freely, every word you can speak, these are not guaranteed. They're temporary gifts that can be taken away by biology, trauma, or simply the passage of time. If this journey through medical extremes has made you reconsider the fragility and preciousness of human existence, leave a like to support content that explores the darkest corners of medical reality. And if you want more revelations about the boundaries of human endurance, subscribe to the channel where medical science meets the limits of suffering. Until the next exploration of biological extremes, cherish your ability to feel, to move, and to exist without pain. These simple capacities are more precious than most people ever realize.